and welcome to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group, and today we have a very special guest, Stella Zaimi, the CEO of the Illinois Back Institute. Stella, thanks so much for taking time to chat with us today. Tell us a little bit about your professional background and the Illinois Back Institute.
Thank you for having me. I've been in the business for many years. Then I got involved with Illinois Back Institute about 17 years ago. Was just a small chiropractic office at that point. There was no protocol written or created as it is now. In the beginning, we're seeing actually results of the patients, but there was nothing to determine or prove that actually what we're seeing is happening in the patient's care when it comes to chronic pain and treating herniated disc, sciatica, stenosis, bulging disc, degenerative disc disease. So at that point, we decided to sit down and actually write down and document and gather data to see the patient's care outcome. Like what we're seeing is really happening. And then we decided after that to do a study, doing MRIs before and after to determine is there changes happening in the discs without the surgery, obviously, and without medication. That's how we treat the spine here at the Illinois Back Institute. We conducted the study and we found out that within one treatment, there was up to 18% of rehydration of the disc. But most importantly, when we continued the study, because we knew, okay, one visit did this to the patient's spine, to the discs, what does it mean, course of treatment? And how long does that take? What is it needed? So we continue to do more studies in that nature internally, with third party doing the MRIs, obviously, and reading them. Radiologist, doctor, and we found out that within an average of 3 months, we actually were eliminating herniated discs.
So explain to me, for somebody who is not familiar with this non-surgical, non-medication related course of care for spine conditions, you're treating herniated discs and your data is showing positive results, non-surgical. And that's the biggest thing, right? People who are out there dealing with chronic back issues, they try everything out there besides surgery. Surgery is their last option and they exhaust all the non-surgical options. Most people don't get better permanently with the non-surgical options, and then they end up with a spine surgeon. What you guys are providing sounds to me like something that is not very well known in the industry as being a available course of care, a non-surgical treatment for spine care. Tell me exactly what you're doing that's helping these disc herniations and other spine conditions without having surgical intervention.
Well, it might not be very well perceived or known in the industry because we actually took the time and thought out of the box. What we do here, we take the pressure off the discs in 3 different positions: sitting, standing, laying down. That's how your body functions every day. So as you take the pressure off, we allow nutrients and oxygen to flow in and out so then you can start healing them or taking care of them slowly to reverse the process of degeneration, herniation, bulging, sciatica, and stenosis. Obviously, sciatica and stenosis comes from the disc degeneration or bulging or herniated. Then we have combination of exercises and taking the pressure off. So it's a combination of things that we do. Again, no surgery, no medication, and our data shows, and we do treat oswestry of index, which is a measurement that the medical society uses, how bad it is. We get patients with 46%, 60% disability index, and we get them back to normal. It's in a combination of exercises and the traction that we use specific, the way we do it that reverses the process of herniation and degeneration and bulging.
Wow, this is fascinating for me to learn. Why aren't physical therapists or chiropractors able to deliver the results you guys are providing?
They're focusing on one aspect of the spine, right? There is different aspects. You cannot, for example, a chiropractor doctor, it manipulates your spine, correct? They do that so they can allow the discs to have motion. When the discs have motion, that's how they get nutrient and oxygen. They're moving. Physical therapy will focus more on the core, right? Muscles and strengthening. They will do the manual. They'll do some other modalities, but that's their kind of like overall treatment. So it's only one aspect of the spine. In order to reverse the process, you have to work with all the components that are causing the disc to break down. From the disc itself, taking the pressure off and allowing it to get nutrient and oxygen, then with the muscles surrounding the spine to reactivate them, re-educate the body to use correct muscles again, work with the posture, work with the gait pattern, and then communication of muscles and nervous system. When you do all this together, that's how you reverse the process of degeneration or herniation.
So you've developed a process to come up with the right exercises that have proven to be effective when they're used in combination with the right cadence and repetition that has just never been formulated before, that's widely available for patients.
Correct. We have already published 2 studies in PubMed, which is a major medical journal. Our data shows that we're by far get the best results. And moving forward, we are going to try and grow as a business overall, all over in Chicago, but also nationwide, so then more people are available. That's actually our mission. So people have, where to go and get this treatment. We get phone calls. The other day, I had from Australia email. I had from Germany phone call. How can I get there and what, it is required. So obviously, right now I'm going to stay in America, but you never know.
And you're servicing patients in the Chicago, Illinois market. But this is such a unique offering and such a unique non-surgical option for patients suffering that, like you're mentioning, you attract patients from all over the country, I imagine.
Correct. Yes. Over the years, we have treated a lot of patients from all over United States and Europe. From Canada, they have come here, stay at a hotel for a month and a half, and then they get everyday treatment, and then they go home, and they don't come back. The goal of this protocol is not to make you feel better today, and then 6 months down the road come back. The protocol will work if you start and finish, obviously, and you put your effort. There's no magic pill. There is no quick fix.
Wow. Yeah, you're not looking to put a Band-Aid on the problem. You want to find a permanent solution.
Correct. And that's why I tell all the patients when they come in that if you start and finish and put your effort, you are going to get the results. And they do.
And how long is the program?
It's an average of 3 months, 3 times a week, about 2 hours.
And how many patients are you treating in a year?
My goodness, we have treated tens of thousands of patients in years, but in a year, about 2,000 patients to 3,000 patients
per year.
A year, yeah.
Wow. And I think you said that you're also taking Medicare patients?
Correct.
That's awesome, because most spine groups and practices don't want to treat the Medicare population because they don't get the reimbursements they're accustomed to.
Correct. And they need it the most, though.
They need it the most.
Yeah, I mean, a business is a business, right? It's about the money and profit and everything. But on the other side is how about humanity?
Yes.
How about helping? How about making a difference?
Yes. And as a provider, you chose a profession of providing care to patients. That's the number one goal each and every day.
Yes, we're making a difference. We take it for granted because we do it day in and day out, but we truly are making a difference. And that's fulfilling.
The practice has grown probably a lot through word of mouth referrals, I would imagine.
Correct. Yes. We actually get patients constantly calling us and saying, oh, my cousin was here years ago. And I love that, because years ago, someone came and they still remember us. That is our goal, to make sure that we can help as many people, just to cut short this circle of from doctor to doctor to doctor, and them suffering and getting discouraged, and depressed in the process. 99% of these people, when they come in, they are depressed, because a chronic pain does take the toll. It changes you as a person, trying to modify your lifestyle and being in pain every day, all day. So yes, we do get referrals. We do some marketing on our own, but mostly it's patients' referrals.
What are some strategies that you've seen have worked for you guys to get new patients to call or contact you through the website? What are you doing on a digital front to attract new patients?
So we do a lot of video education on Facebook, which works very well. Patients actually will pick up the phone and say, I saw you on Facebook. We do organic, lots of organic. So they'll go on our website and actually they'll take their time to see and read all about it. And then they come in. So that's what we do normally for our marketing.
So you're doing a lot of like patient success stories on social media. Do you get a lot of patients to share how life-changing your practice has been for them?
Yes, we have a lot of good testimonials and a lot of and good reviews, but also we educate. What is it sciatica all about it? What is herniated disc all about it? This is the journey, what happens when you have that, and what is the end result and what you're going to go through. So kind of speak to them in a way that they understand and they can associate with. Usually people come in and they're like, yeah, I was looking at your video and it was exactly my story. So then they come in.
Since it's so unique of a concept, you really need that patient verification to say, right, this isn't true, real, it happened to me, best decision I ever made, to complement your messaging, which is saying, here's why we're different and here's what our outcomes look like.
Correct. You're right about that. Yes.
So tell me, in your opinion, what is the most pressing issues for medical practices going into year 2023? What are the biggest issues for the practice and then the patients that the practices serve?
I mean, staffing. We're like burned and run so thin. We're doing like 2 or 3 different positions in order to get, so patient care is suffering.
With there being limited amount of people, quality staff that you can hire, what are some ways that you've attracted quality people to join your team?
So I've used all the big ones, that platforms that everybody does. Okay. But I actually personally have been lucky to make sure that the one I have, which are very good, to keep them.
Yeah. It's very, very important to keep your staff engaged and feeling challenged and feeling appreciated. The cost to replace a staff member is much greater than most people anticipate.
Correct. Yes.
Especially a high quality performer.
Correct. You're right about that. As a practice, my philosophy always has been be a team, right? Team oriented. And it's not about team oriented like everybody sometimes uses it on the book, the big, nice books. Actual team. Engage them as a team, as a family. Make them feel part of the success. So we make it fun and engaging. So we've done a good job of actually working as one body versus That's your role over there. You do your role. I'm going to do my role, and that's it. Or one person, one perfect machine, one perfect person. That's what I've worked very hard to create. And so far, it's been very successful.
Yeah, you've really taken the family atmosphere to a whole nother level of really making sure everyone feel supported and appreciated and having open dialogue, so you're not just hiding behind a wall in your cubicle.
Yeah, I mean, yesterday my nurse practitioner came in and she needed to vent. Most of the time, staff need to vent. You don't need to fix their problems all the time. She came in, I was sitting, and she said what she had to say, nothing bad. She just needed to vent. She needed to get it out. She got it out, and then in the end, she was smiling.
You've really developed a very superior level of respect for everyone on the team.
Correct. That's another philosophy, especially providers, right? Providers, doctors, nurses, or PTs for that matter, chiros. There is a level of ego, right? I don't allow that here because a doctor, it's not successful as a good doctor without his supporting staff.
Wow.
You know, there are people. I had a PT one time and he yelled at my staff on the floor saying, "Oh, your paycheck comes from me." And I'm like, we're done. You know, hopefully I taught him a lesson. Hopefully the next job you'll be more kind to these people. But yeah, we're good. We're lucky. We have a good team that way.
Wow. Stella, there needs to be more CEOs at medical practices like you, because I think you're 100% correct. Unfortunately, when a lot of these practices are owned by the provider, the staff, the supporting staff, feels inferior, and they feel they can't be open, and they don't get the respect that they feel they deserve. And the reality is, those are the people that are going to make the difference in the patient's day-to-day experiences.
Correct.
At the practice. The people answering the phone, the people taking their insurance documents, the people scheduling them for their follow-up or making a referral to another specialist. They have more impact on the patient's good or bad experience than the providers in many instances.
Correct. You're right. That's why here it's not allowed.
Well, Stella, I've thoroughly enjoyed our conversation. Yeah. I think we learned a lot from some of your approaches to managing your team and growing the practices. We've learned a lot about this revolutionary approach to spine care that you're offering, which is wonderful. Thank you for your time today.
Yeah, thank you. This was fun.
I would love to follow up with you in a few months to learn how everything's going at the practice. Okay. And, maybe learn about new initiatives you guys are taking over at the practice to get more people involved in this type of non-surgical solution for spine care. Hopefully, through this podcast and other channels, more and more people will know that the Illinois Back Institute is a great first stop for their spine care.
Yes, we should be the first stop, not the last.
And for many reasons so.
Correct.
Thank you so much, Stella. Have a wonderful day.
Bye.